Hi everybody, I'm Yushim Kim, faculty at the School of Public Affairs and fellow at the center. I will talk about my thought piece with two other colleagues, Professor Seong at Hanyang University in South Korea and Wang at Arizona State University. Infectious disease outbreak has interested me about a decade sporadically. My first exposure was 2009 H1N1 outbreak in Arizona. At that time, I worked with epidemiologists, applied mathematicians, and engineers to simulate government risk communication effort to the public during the crisis and to help state tabletop exercise with practitioners using simulation models. About 5 years ago, another event occurred in South Korea got my attention. For the last few years, I have collected and analyzed the complex response network of organizations in the national plan as well as during the crisis. Those who are interested in simulation technique, network analysis, and relational data collection from archival sources, please check the papers that I published in various journals. There are several of them. In my mind, simply the most critical factor in differentiating the difference between COVID-19 response outcome across different countries at this moment is their healthcare system's capacity, not the government system. However, my talk is not about healthcare system, but the national incidence management system, focusing on the issue of coordination and authority structure in a large-scale public health crisis. Back in 2015, the MERS coronavirus syndrome outbreak in Korea was a significant event with 36 deaths, 186 confirmed cases, and over 16,000 suspected cases. I spent several years now to study how the country dealt with this crisis and failed. Nowadays, MERS outbreak feels like a small episode. For the last 4 months, there were over 200 deaths and over 10,000 confirmed cases in Korea, and see the difference in its scale in that country. Nevertheless, Korea has dealt with the COVID-19 crisis much better than MERS coronavirus outbreak in 2015. The US situation is worse. We are experiencing over 50,000 deaths and over millions confirmed cases as of May 1st, 2020. We know that the two countries are not comparable in terms of their total land area, government systems, and cultures, but look, when the first confirmed case was reported in the two countries the same day, the January 20th of this year. In April, we are observing drastic difference between the countries in terms of how the crisis has been responded. In this perspective piece, I was trying to reflect what I learned from my research on Korea's case to make sense of the US situation. I need to explain two pieces of information first. In terms of the infectious disease, Korea categorized the risk as 4 levels. Blue, as the lowest level, indicate that there is an outbreak elsewhere while it is not imported to the country. Yellow means that there is a domestic case reported. Orange means that disease spread to other parts of country. Red indicates widespread community transmission throughout the country. This risk assessment and levels are important because it is the basis of the country's response action during the infectious disease outbreak. New Zealand has a similar system for COVID-19, yellow, 2 shades of orange, and red with a specific measure to take in each level. I just learned that not every country has a warning system like this, and US does not have one for the public health risk. In this presentation, we will first look at the Korea's National Plan on Infectious Disease Crisis Management, prepared by the Ministry of Health and Welfare in 2014 December. I will then explain 2 interesting decisions Korea made during the MERS outbreak in 2015. Their standard manual was revised in 2019, just before COVID-19. I will talk about few changes made by the Korean government. Then I will present Korea's response system to COVID-19 right now. From the next slide, you will see a slide with complex figures and text. It is because I'm citing somebody's work. I will try to deliver only key points, just follow red font or triangles in the slide. What you see here is like an organization chart in any agencies. The difference is that this is an infectious disease crisis management system Korea prepared before the MERS event in 2015. It defines which organization and agencies are supposed to coordinate and collaborate with whom. Two interesting points that I would like to mention. First, KCDC was planned to be in charge of responding to the crisis at yellow or orange level, and at the red level, the Ministry of Health and Welfare was planned to be in charge of responding to the events, collaborating with the Ministry of Public Safety and Security, which was established in 2017. The text in red font are what I inserted for this explanation. Second, when the crisis became really serious, they plan to respond to the crisis by creating Central Safety Management Committee led by the Office of Prime Minister. Epidemic graphs looks like this, start from the first day till the end. One or two peaks, it often include new cases, confirmed cases, and so forth. During the 2015 events, Korean government made two interesting decisions. First, they responded to the event at the yellow level until the end of the crisis, even though MERS case was confirmed in other parts of the country. Second, they created an ad hoc organization named Central MERS Management Headquarters. This CMMH was not the organization in the standard manual that we saw. This organization looks like the combination of functions of the headquarters that was supposed to be established in KCDC at yellow or orange level, or the one in Ministry of Health and Welfare in red level. This event has been largely considered to be a failed response. Major critique was given to coordination problem and authority conflicts. Some of the conflict were related to resource mobilization between different jurisdictions and locality. Other conflicts were related to who has authority over critical health information and necessary decisions. There were conflict between the central government and city of Seoul. There were conflict between government and major hospital that was dealing with the MERS patient. I recently obtained the standard manual revised in 2019 and saw some modification. Three things are worthy of pointing out. The system chart explicitly includes which organization is in charge of what risk at what risk level. Unlike the previous plan, they have a clear organizational plan for large-scale event. Central Disaster and Safety Countermeasure Headquarters will be led by the Prime Minister or the Minister of Interior and Safety. They also separate out local disaster and safety countermeasure headquarters from the local government, but still led by the mayor or the governor of the local areas, collaborating with the local governments. During the COVID-19, Korea escalated the risk level to red on February 23rd, and Central Disaster and Safety Countermeasure Headquarters has led the response since then. Before this headquarters was established, the headquarters at KCDC was established on January 20, Central Disaster Management Headquarters in Ministry of Health and Welfare on January 2017, corresponding to the risk level elevation. The confirmed case peaked on February 29 and has declined since then. Korea has less than 10 confirmed cases per day these days, which most of them are those who entered into the country from outside rather than domestically transmitted case. This is another way to represent the current response system. You see that KCDC is a big part of the system, but there is a head of Ministry of Health and Welfare as the first vice head, and Ministry of Interior and Security as the second vice head under the leadership of Prime Minister. The head of Minister of Health and Welfare as the first vice head rather than head of the Minister of Interior and Security is different from their original plan that we saw. Local disaster and safety countermeasure headquarters are also established and working with the central headquarters. There is no significant coordination or authority conflict that I have learned yet. It is really difficult to project the scale of emerging infectious diseases in advance because of their contagious nature and exponential growth, as well as ability to cross the geographical boundaries. When it becomes a national crisis, national coordination system seems to be needed or necessary rather than having it to local or regional separately. But the question is how? After 9/11, the US has relied on National Incident Management System, NIMS, as a guiding principle of disaster response. The incident command system has been serving as an organizing structure of the NIMS. I learned a couple of things about their utility in public health crisis. There was some uses of ICS in public health emergencies like H1N1, but the literature suggests that it has not been easy to integrate hierarchical ICS principle with the public health functions, even at the local or regional level. On top of that, US does not have experience of large-scale infectious disease outbreak like the current pandemic after H1N1. COVID-19 seems to be the real test case of the system that has been developed and used for other disasters like wildfire, hurricane, flood, and so forth. I am convinced by the argument that public health crisis such as infectious disease outbreak is somewhat different from other types of disasters, which may call a different frame of mind to respond to it. I think it is right to give sufficient and significant authority and responsibility to health authorities. However, that may be insufficient in the large-scale epidemic or pandemic like this. There got to be well-established coordinating and supporting system to address coordination problems and authority conflicts. I'm not suggesting that Korean-style government system, which is known as unitary system of government, and how they managed COVID-19 is the answer for the US challenge. I'm suggesting that if the US government system is based on different philosophy about the relation between federal government and state government, there's still got to be something that can enact and move such a federated system with swiftly and effectively along with the health authority, which seems to be a real challenge here. The biggest lesson of this pandemic is that being a country that controlled the outbreak well momentarily is not going to address global pandemic. Singapore responded so well at the beginning of the outbreak, but is currently experiencing spike again. Korea is dealing with those cases from outside in the country. We cannot stop people or the virus move around across the country in this connected world. It requires global effort to be truly effective in the situation like this. I don't have an answer for these two calls. I just would like to remind that governance issue not only critical, but also challenging as much as the healthcare system issues in epidemic and pandemics. There has been too little attention to this important challenge by public affairs scholarship as well as policymakers. It is the right time to discuss the homework and make progress to prepare for the next one that must come, which we just doesn't know when. Thank you for listening.